Good morning and welcome everyone to today's webinar. By way of introduction, I'm Anne Livingston and the Chair of the Queensland Government funded Community Care Smart Assistive Technology Collaborative. I will be moderator for today's webinar titled Smart Assistive Technology in Wearable Devices for Supporting People with Hearing Loss. This webinar is part of a series of sessions being facilitated by Community Resourcing for the Community Care Smart Assistive Technology Collaborative. These webinars have been designed from feedback and requests that we have received through the collaborative. Our webinars are bringing together local, national and international perspectives in research and development, as well as focusing on the deployment of smart assistive technology in the community care sector. I believe that this is the 29th webinar in our current series, and you will note from recent webinars we are drilling down on specific issues as requested and identified by members of our collaboration. Our community resourcing has extensive international linkages, and we're fortunate to work with many international projects and research. You see from a few slides the names in the following slides of some of the groups that we've been involved in. We're very pleased to and proud to announce that we were awarded in the first week of December the Best Initiative as voted by consumers at the 2010 ITAC Awards. And many will recall late last year we were awarded the National ICT Innovative Entrepreneurial Project of the Year Award for this particular project. Excuse me, a very exciting and recent development for us includes being finalists in the eHealth Queensland Startup, an innovation showcase for a project that has emerged from a collaboration that's occurring in our collaborative. We're also particularly proud to mention that a number of our expert reference group members have been recognised in awards for their work. Particularly with this project, and I would particularly note Professor Greg Teggett being recognised in the Australian of the Year program this year, and is currently ACT Senior Australian of the Year on the back of his agenda to see more widespread adoption of technology. I'd also like to note that Dr Mohan Karunanithy, Dr Eleanor Horton, Stuart Koplik and myself have recently been appointed by the Minister of Innovation, Science and the Digital Economy and the Minister for Small Business as Advanced Queensland Community Digital Champions. Our expert reference group ensures that the information and activities relating to this project are of high quality and focused. Now, I'd like to take the opportunity to highlight the work of our voluntary expert reference group and the project team in respect to, also to the amount of engagement work that has been undertaken both within the collaborative site and statewide, nationally and indeed internationally. Recently we held a number of Smart Assistive Technology events which engaged individuals, family members, formal and informal carers and service providers throughout regional areas. It's great to get out to regional Australia and share the possibilities and benefits that new technology can deliver. It's great to have so many of these new participants in today's session, as well as welcoming back many who have attended past webinars. Today we have representation from every state and territory, as well as some international visitors who have come on board today. I particularly acknowledge those attendees who are bridging time zones to participate. It's also great to welcome many colleagues from Arata who are joining this webinar today. If you haven't formally registered for the collaborative, our website's up here on the slide now. I'd encourage you to formally register and that way you will get provided with all the information from the collaborative. Those of you who have attended previous sessions know that community resourcing has been funded by the Queensland Government to bring together this online platform For service providers who are interested in collaborating on issues and practices related to Smart Assistive Technology, as well as for individuals who want to incorporate Smart Assistive Technology in their home and in community settings. Our project has achieved to date extensive national and international geographical reach, and this is growing daily. As many of you are aware, we're in the final stages of revamping the platform, as well as putting together a consumer portal on the site. We've employed co-design and collaboration concepts in developing this new area, and I particularly acknowledge the assistance in the consumer portal site that we received from Paralympian, Carney Liddell, and from several consumers led by Amy DeGara, who've helped us with that engagement. And we look forward to your feedback on this new enhancement. Please note that neither Community Resourcing or the Department of Communities, Child Safety and Disability Services are promoting or endorsing any particular product, research entity, individual or organisation. Rather, our webinars serve to inform viewers of examples of various smart assistive technologies in development and or in deployment. As attendees at today's session, and in the interests of recording, we have muted your microphones. But we encourage you to ask questions, and these questions can be added to the question pane on the dashboard on the right of your screen. We'd ask you to post these questions early. We've been inundated with questions in previous webinars. We'll try to get to all of them at the webinar, and those that we can't, we'll follow up with participants after the webinar. In today's session, Dr. Kevin Doughty is joining us again, and he will discuss the role that Smart Assistive Technologies can be a great benefit for individuals with hearing loss. Many of the attendees at today's session have also attended a previous webinar that Dr. Doughty delivered on Smart Assistive Technology for vision impairment. By way of introduction, Dr. Kevin Doughty has been involved in the specification, development, implementation and review of smart and electronic assistive technology strategies and models for over 25 years. This role has really evolved from his personal and professional interest in telecare and assistive living sensors and communication system design. He's been both involved in trialling and evaluating in pilot as well as large-scale rollout studies. His career has spanned many aspects, including originally as an academic and researcher at the University of Wales, and then as a service provider in his own right in a supported living accommodation. Kevin's currently wearing a number of hats currently. He's director of the newly formed International Centre for Useable Home Technologies. This centre builds on the work over several decades that has been undertaken at the universities of Coventry, Newcastle and York. He's also director of the International Telehealth Quality Group. Kevin's an advisor to the Welsh Government on service reform. He's also been an advisor to the UK Government on innovation and e-healthcare, and he's an advisor to many UK, European and Australasian projects. And Kevin, I know that you're currently working on several projects in Australia as well, specifically. So I'd like to welcome you, Kevin, to today's webinar. And thank you particularly for staying up so late tonight to be able to present this webinar live.
Okay, thank you. Well, I was discussing the 3 eras of care. The first one was very much focused not so much on the individual, although family support was anticipated and expected, but on buildings. And this is what gave rise to geriatric care. And hospitals perhaps as the place of safety, replacing older workhouse and public assistance institutions. During the 1990s and onwards, this gave way to a community focus where people were encouraged to stay within their own community in whatever form of housing and care that might be. But this is where we were introduced to domiciliary carers, home helpers, and indeed packaged care to help people stay at home with the support of some form of personal assistant. That's the current situation as we move into the third era of care, where the focus is again on the person, but now on the use of technology to enable them to manage their own care, what you might call self-care for people who have long-term care needs. And in particular, this is an era of new innovation for most people, because they will need help from professionals and indeed from their service providers so that they can combine their options. They will need the safe place, they will need support from carers where appropriate, but increasingly that support will come through technology in its various formats. But it's that transition perhaps that will be difficult, and that's where we are today. And that's where Smart Assistive Technology comes in to support the person-centered care agenda, because we're moving away from that old model of professional dominance, which was episodic, it reacted to people's problems, and it was very much a practitioner and problem-based approach. We now have the individual in charge. It's less restrictive, it's preventive, and it focuses on what people want to do and how we can improve their quality of life. So it's very much a new order. People, consumers, are being empowered to look for choices, and the old idea of a prescription coming from a healthcare professional is now out of place because the consumer is in charge. So that's the context where we look at individual groups, and today it's about hearing impairment, which is the inability to correctly or fully appreciate sound waves as they come across to us. And sound, it carries information, it carries speech, it carries music. So it plays a big role in our development. The problem with hearing could be due to several factors, from trauma and medication and some infections, right through to the most likely cause, which is age-related progressive hearing loss. And because people are thankfully living longer, this has not only been the dominant factor for the last century, but it's going to be even more dominant as the population ages into this 21st century. So by way of consequence, we already have a situation in the developed world where over 70% of people aged 70 or over, and 40% even at 50 have some form of hearing loss. Data from the UK suggests that it's reaching 80% prevalence for people in the 8th decade of their lives, and it's just about everybody who is in their 90s. So that is very much an old age problem, but of course it also exists at many other ages too. Across the world, over 1 billion people, most of them hearing impaired, some of them actually deaf with little or no hearing, and that's about 125 million. So from a marketing perspective, if you're delivering services or products, an enormous market. From a service provision perspective, most people who come to a service provider are likely to experience hearing loss at some level. The impact will depend on someone's stage of life. For children, they won't learn languages and their development will be retarded. They'll be unable to communicate and perhaps socialize later on in life. In adults, it can cause problems in the workplace. It can cause risks, introduce risks to safe practice, as machinery may not be heard, and it will cause social issues, developing relationships when one is unable to speak to a colleague, for example. But in old age, it has a particular negative effect because it causes social isolation and loneliness. People can't go out, enjoy concerts, go to the cinema, and there are also physiological problems associated with poor hearing, including the risk of falling. So generally, technology plays a number of roles, and we have to differentiate between the different types of technology-enabled application, from the reactive approach right through assistive to preventive. And the level of use really depends according to the level of need. Those at the top would be critical, but there is a role, an assistive role, right through all these possible applications. And by assistive technology, I mean at least three things. The system, the device, the arrangement makes things easier for people who have any deficit, whether it's physical, emotional, psychological, intellectual or sensory. It helps people to learn, so that's really important for people in their younger development years, but it also helps the carers, the family carers, the informal carers, to support people, because it often makes their jobs easier too. So I like to consider this as the pillars, the four pillars of assistive technology. The first pillar, which you see on the top left, and which includes things like grab rails, stair lifts, any form of ramp, special bathing, whether it's showers or walk-in baths. They're fixed, they are adaptations to the home environment. Perhaps greater in number and lower in cost are portable assistive devices, tools for living. And then there are the electronic assistive technologies, the things we believe are designed specifically to help people who have sensory needs or who need functional support. And the final one of the four are the connected ones, perhaps better known as telecare or telehealth or telecoaching. These are mechanisms or devices and systems that help people become virtual in their care options. The significance is perhaps more easily identified by drawing a horizontal line. Those above the line are mechanical mainly, those below electronic or intelligent, those on the right quick to provide, and therefore it can get someone out of hospital quickly. Those on the left need more thought and planning and are often designed specifically for the individual's needs, but they take longer and often cost more because of that. So if we start off with fixed AT, what is there in the home, or what can be done to a home specifically to make it better for someone who has a hearing impairment? Well, the answer should be very little, but in practice, as with all technologies, there is something. And this diagram shows you a technique where walls are made in a special way that allow sound to be focused on the individual. So in principle, these type of focused arrays can track the person who is in need of higher amplitude signals. So rather than flood a house with very loud noise that other residents might struggle with, this is an approach which makes the house intelligent for the benefit of the person with hearing loss. Portable assistive technologies, well, these are things you can carry with you. They're bound to be small. They're the sort of things you might want to take on holiday, for example. So an alarm clock with a vibrating pillow pad to wake someone up because an ordinary clock isn't good enough. A watch that will vibrate when the alarm goes off. And there are other little devices, relatively low-cost devices that help people with hearing impairment and are low-cost and very portable. They're not wearable, so really they don't fit in with my agenda today. Whereas when we come to electronic AT, and this covers the whole gamut, I'll very quickly go through some examples of prosthesis, mind control, speech deficit, environmental controllers, mobility devices, leading up to personal assistance and sensory impairment. And of course, that's what's really interesting today. Someone who has hearing impairment, one group of products would be cochlear implants. No real age requirements. I personally know someone at age 94 who's had a cochlear implant that's very successful, but compared with the more traditional hearing aid, all tests have shown that people can focus better, especially in noisy environments. Their conversations are better, they feel safer, and the hearing is demonstrably better than that with a standard hearing aid. This is an important list of factors that explain why people don't use hearing aids as much as they should do or when they should do. It's one of the perhaps strangest factors of human nature that we can find a product that will make our lives easier, but we won't use it or wear it for reasons that are individual to us. But I've listed 9, 10 or 11 of these. We can't go through them all, but I'm sure you'll relate to the bottom ones here. The wearability, well, how do you improve that? Well, colour, especially for children. They can improve wearability in the same way as mobile phones improved access when people started having different colour skins for them. So this particular group, they're compatible with peripherals also. So this really does improve people's wearability and the usability. More acceptable designs, things that look like jewellery, things that can be passed off as other items of technology, and functions that work in a discotheque, for example, where the speech capability and sharing of hearing is restricted by particular devices and by looking in particular directions. Another factor is sensitivity. People buy hearing aids which work but not quite well enough. Can we boost that hearing? Well, actually, if we start using the technology that's used in submarines to listen for activity underneath the sea, then we can boost not only the actual sensitivity, but the frequency response as well, which means that words with the S, the hissing sound, the high frequency components that are often missed, they're far easier to amplify. And there are other devices. The ear lens, for example, it directly vibrates the eardrum and therefore takes away many of the interfaces and makes the reproduction far more reliable. Sound reception itself, hearing aids are getting smaller and smaller, and that means they can approach the bionic ear arena. They will mimic nature, and we will be able to print things that can be fitted in or over existing ears and therefore integrate electronic components in such a way that there won't be a telltale sign of an added hearing aid. But they won't have to be that expensive. There could be far simpler approaches. Earbuds, already used by people on aircraft, for example, to get rid of the noise. Doppler Labs make this particular one, and it's very good at eliminating or cancelling out the engine noise of aeroplanes, motor cars, helicopters, and it allows quick tweaks to try and get the human voice components above the background noises. And there are similar ones, much lower cost devices, but they're all sharing that wearable feature of being discreet, small, and actually quite colourful and therefore acceptable. This one's actually more of an amplifier than a hearing aid, although it costs so much. But in being an amplifier, it perhaps has more potential for simply making sounds louder and therefore easier. A Dubs one, the lowest cost I've ever seen, $25 US a pair, and it's actually eliminated, filters out much of the noise, allowing people to hear what they want to hear. And then we have the smart hearing aids themselves, and this is using some technology that goes into the ear like an earbud, but now has a control pack which really is filled with digital electronics that effectively zero in on the speech element that's in the environment, thus cancelling all those other obstructive causes to the hearing. And to make it better, or to test things out, there are panels, and this is from the University of Essex, how they've developed a dummy approach to try and look at how things develop. Doesn't, of course, have to be in the ears. In fact, some people simply don't have any mechanism within their ear, outer ear or inner ear, for translating the acoustic waves into sounds that can be interpreted by the brain. And that means using other parts of the body, codes, for example. So this is a neurostimulator that uses the tongue with all its receptors. And again, it's a code that feels vibration. The vibration means something in terms of a sound signal or words. Needs training, but it has great potential. And in the same way, but using the body, the abdomen instead, the torso itself, there are ways of creating vibration patterns that people can indeed interpret. Again, lots of training, but they will recognize words by the pattern of the vibration. One of the most important quality of life factors for older people, other than going out, is staying in and watching their own TV programs. But they often miss it because of volume issues. Soundbox works independently of the TV speaker. So the rest of the family could be enjoying the TV at standard levels, but the person with a hearing impairment may have their own personal amplifier. There may be a hearing loop. Again, that's something under individual control, can be used in any building. And very important are personal Bluetooth headphones. Bluetooth being wireless means that we can start linking smart devices, smart TVs, music centres and other players direct to the individual without disturbing everyone else, enabling them to increase the volume, again without creating a problem. So if we can't hear, can we read? And most people who have hearing impairment can read a screen, they can read text. So this is the early stage of a microphone, processing electronics, displaying it in a head-up display. And that was similar to what Google Glass did, but Google Glass went a little bit further. They allowed the person speaking to be identified. So imagine the situation in a classroom where the teacher, if the teacher is deaf, can actually identify who is speaking, and it can have that transcript displayed on a head-up display there. And Sony, they have managed to separate their caption screen from the rest of the imagery and combine them for the benefits of someone who's wearing Sony's special glasses. So that's electronic AT. What about connected AT? Well, connected AT has developed an awful lot. In fact, I describe these as a journey by sea, because this takes a long time, but it's been in what I describe as 7 waves, and you'll notice, certainly those of you who are used to surfing will notice that it's the 7th wave. That's the big one. Well, the first wave was the simple telephone. Then we had telecare alarms. Then it moved on to vital signs monitoring, wearable alarms, and that's a hint for where we should be with regard to hearing and indeed sight improvements. Then there's video and personal care technologies, and ultimately we'll be at the social robotics stage for that big 7th wave that will really transform life for people, older people, disabled people. But to begin with, that telephone. The telephone really is important for people whether they can hear or not. Most phones can now be specified in terms of the needs of someone who has a hearing impairment. And it's not asking for a lot that they have a hearing loop setting, a T setting. There should be a boost for the volume. We're used to our phones vibrating. We need the hands-free option. We need to put in inductive loops if necessary, and we need to be able to have a privacy setting. Well, smartphones, they already have the Bluetooth and the ability to run apps. So the future of connected care, as far as people with hearing impairment or loss is concerned, is in the smartphone. And the relevance is, of course, that the smartphone already has really important features, such as the processor and the touch screen and the contactless ID and the sensors, all the way from the microphone down to proximity sensors. That will be the platform for mobile care, mobile health applications, but also for overcoming many sensory deficits. And that's because it has the microphone, often two of them these days. It has a vibration unit that's equivalent to the vibrating bed pad. A quality audio arrangement, the ability to move treble and bass components as required. And of course it has the camera as well to enable display of what's actually going on. So those are the enablers within a smartphone that everyone has. And to begin with, that Bluetooth headphone, we certainly have those as an ability to listen without showing everyone that you're holding a $1,000 smartphone in your hand, because that's a risk, but that could stay in the pocket or in a handbag, and you don't have to fiddle with the buttons all the time. So many of the peripherals that are shown have developed, and they can be transferred to the smartphone. And some, indeed, like the Resound Link shown there, it'll stream directly to an iPhone or through some other radio-linked phones. So what's actually happened? Well, electronic AT, the sensory support, it's converged. And this convergence gives us something new. And that, I think, is what Smart AT is all about. And I think the Queensland Government should be congratulated for recognising the significance of this new component. And indeed, the collaborative should also be recognised as an instigator of this new movement, where these factors are merging, and many of the functions that were previously hardware-based and very expensive are now being empowered through standard smartphone devices plus apps. And there are thousands and thousands of apps. I'm showing the My Health Apps website, where you can click on support for sensors, which gives you another particular group of, there are perhaps only a small number under hearing loss, but it gives you some examples of how we can start in this. So the first point, and this is important I think for anyone who is trying to control their smart hearing aid, they're too fiddly, they're small, people have dexterity problems, people have osteoarthritis, they struggle to press these small buttons, they struggle to see these small buttons even. So manufacturers of the smart hearing aids provide their own apps, and the app itself allows you to make the adjustment on the screen of a smartphone or even on a tablet device or an iPad, because that's much bigger, easier to see. So here are a range of manufacturers and their respective apps, and when you have access to the soft version of the complete presentation, you'll see that these are hyperlinked, so you can go straight to them if you're interested in looking up these apps. Hearing tests, well, of course they should be performed in a quiet room, a soundproof room, wearing headphones, and it's a potentially long and arduous process to get the full hearing profile. But they can be done rather quickly, perhaps crudely, using apps that are already resident on a smartphone. So these are a range of apps, again, very quick ones. You here I've employed, and it actually confirms what a full audiology test gave. There are lots of other very low cost or no cost apps to test your hearing, but many of them don't actually give you your profile. That would be useful to generate your own profile for an amplifier or hearing aid. What they tell you is your hearing age. Well, hearing age doesn't really mean much, but I tried one earlier today, and I'm very pleased to report that my hearing age is 52, which those of you who know me will recognize as is on the right side as far as my age is concerned. So to tune your own hearing aid, what do you need? Well, this is from Norway, but this is a nice user interface enabling someone, and it's the lady who's been tested. She's got her headphones in, and she is listening to different things, and she is effectively producing her own profile that will go straight onto her hearing aid. But can the phone itself be the hearing aid? Well, yes it can, because the signal processing within the smartphone is already sophisticated. It has filtering, it has amplification, and therefore it has the potential to be an excellent hearing aid in its own right. And indeed, here's some more examples of slightly modified programs that allow the phone itself to become the hearing aid. The last one there, BioAid, is by the University of Essex. They've taken an iPhone and converted it in this way, and in tests they showed it performed in exactly the same way as a hearing aid, a purchased hearing aid costing $3,000. So the iPhone was $700, and it can do lots of other things as well. So failing the amplification route, can we simply translate speech to the text format that people can then read? Well, that's based on voice recognition, and we know that personal assistants can do this. Things like Siri or Cortana, they can all do this already. And if we can change this, if we can get a script in real time from people's speech, then people can take part in telephone conversations or in meetings in a very different way. And once more, we have a wealth of such applications available. These aren't all free. Some of them are very professional and actually very sophisticated, and they do language translation as well. So I think we're moving to that arena where we can have speech. We don't need to hear it, but we know what it's saying, and we can know it in a different language even. Roger Voice is quite a nice one. It's a French-based one, and it's the first subtitling smartphone app that was ever introduced. Sign language was perhaps something that was taught to children who had severe hearing impairment or hearing loss as children. It's an expensive process which people find difficult. There's a shortage of skilled signers, and older people struggle to see it and keep up with it. Most of the applications are for American Sign Language. There's a small number for English Sign Language, but of course most countries have their own version. In Australia it's Auslan, and there is an app which you can install that teaches you how to use the right signage. Captions, messaging, can we use more and more text capability? Can we do it visually? Can we add text to images? Much of our communication, WhatsApp, for example, would these days be a combination of picture or even video with text. Where does this go? Well, we have these opportunities to add text to live video. Project Noah in particular allows photos and plants all over the world, and it's this map that can therefore be created using such images. And someone who likes to go to the cinema, they can use an app as well, and this has been developed in Germany to give you your own, if you like, subtitles. So that could be in any language you like to. Tinnitus is a particularly distressing condition. It's the it's the noises in the ear. And there are strategies to deal with it, but most of them are based on distraction, or perhaps therapeutically, can there be some other, perhaps more pleasant noise introduced. But there are lots of apps that allow the phone to create the sounds that are the distraction. And these have had some success. There is evidence, in fact, that these apps are every bit as successful as dedicated pieces of hardware which are designed for exactly the same treatment of tinnitus. General information, well, it's important. Public address announcements are sometimes missed. How can we reinforce them? How can we translate that message into something public? Well, some really useful translation systems that put the text in place at airports, railway stations, giving the arrival times, the departure times, and if there is a delay, when to go to a gate, when to go to a platform. But from a safety point of view, hearing is really important to us. It tells us someone's ringing us, someone's at the door. Indeed, it can tell us if we have a flood in the house, if we have a flood detector. Certainly if there's a fire in the house and the smoke detector is making a noise. So if we have hearing loss, then we both will miss the alarms and we won't get that early warning. Maybe the drip from a leak upstairs that could save the ceiling if you do something about it at the first noise rather than wait. Then we can prevent all that. And people who are exposed to high levels of sound, if their hearing is impaired so that they don't hear high frequencies, and if the high frequencies are the noises that are dangerous, then their hearing could be impaired even worse as a result. So again, another group of apps, easily downloaded, and the phone will now alert the individual and warn them of overexposure or the presence of some audio alert, such as a smoke detector or a heat detector or a burglar alarm. This is a successful app for people who wear headphones. People walk along pavements, they cycle along, and they don't hear the hooting of a car, they don't hear the bell of a cycle. This app is sitting in the background. You can be listening to your music, but if a sound comes along that is identified as dangerous or needs to be alerting, it can interrupt the music to provide the warning. And Jacotti, the importance of this one is that it actually is CE marked for an app, which is actually quite unusual. So it can have, it can look for natural sound, it can simplify speech, or it can simply provide the comfort of natural sound. So that's a benefit of having the processing within an app, within the smartphone, and again using the earphones to deliver sound into the ears as best possibility. So how does assistive technology and telecare interact? Well, there are lots of standalone devices. Some of you may recognize these. These are devices that alert someone or can be used to alert someone of a problem. They can be linked to other devices, worn on the wrist, for example, put under the pillow at night, or big flashing lights to alert someone that one of the other sensors has been activated. They're a bit clunky, they're large, they're expensive, but they are essential if someone is to be kept safe, and they are increasingly part of the telecare system. But there are sensors that alert individually. The Fire Angel range, for example, they are standalone and they use low frequency sounders directly, so they could be worn by the individual and they can alert the person, worn round the wrist, round the head, round the ankle, or indeed as a waist-worn device. So from a service provider perspective, what are the opportunities? Well, I would say consumers are reluctant to have formal testing. They don't like going to the shop of a specialist hearing aid retailer. They think they're going to be sold something that's very expensive. They're not aware of the range. They're not aware of how discreet the modern approach is, and in particular, they don't know that many of the functions of hearing aids can be provided using the smartphone or the iPhone that they already have. Assessment is key, and the assessor needs to know what's available because they might have other assessed needs also, and this is really the opportunity for the service provider to become a one-stop knowledge shop, and in many and increasing cases, because all the smart technology can be delivered through the same platform, that is the smartphone, they become the provider of choice. Looking to the future, well, what do I think will happen? Well, I think the smartphone will actually displace many of the existing hardware devices to support people with hearing loss. I think there will be other items that can be worn, maybe a glove, which will allow control. I think there'll be arrays of microphones because they are small and low cost, and the array can be tuned so that you can hear what's ahead of you, what's behind you, or what's all around you, or perhaps to eliminate the sounds that you don't like. The testing, the audio testing, will be trivial, and it will really be as simple as your understanding of a sentence or two. Your phone itself can be calibrated without sending it away, without going through any great trial, because over the internet it may be done. It may be done using Amazon Echo or Dot or Google Now. The devices that are in the ear will be invisible. They will be so small. They won't need battery replacement because they can be continually recharged using radio waves. And the system intelligence will allow the individual to choose where the sounds are and what the sounds are. So potentially someone can have an audience of 5 people and selectively hear only one of them, even if the 5 of them are speaking at once. So to finish off, Christmas is coming, and maybe it's the time to consider what's needed. It says 4 main things, but actually number 1 and 2 are the old transmitters and receivers. Number 3 is the smartphone. Number 4 are the apps. So for someone who has hearing loss, buy them a smartphone and install some apps for them. Thank you for your attention. A copy of this presentation will be available, as all webinar materials are, through the collaborative. This is based on an article of the month that I wrote in August. That's available from that web address that's given there. Otherwise, please email me, and please join my IQTech group. Membership is free and international. Thank you.
Got a number of questions on the question pane already, Kevin. I'm going to start with a question from Sophia, who works in a very challenging position in working with highly socially disadvantaged groups, some of which those people are homeless. The group that Sophia works with is in many cases aging very prematurely and being prescribed with classic costly devices which are often taking a lot of the budget, the individualised budget. But she indicates that thanks, Kevin, for offering some alternatives to us to consider. They're very worthwhile presentation for us. But do you have any comments about the best applications for challenging settings like ours, and particularly the needs for maintenance and repair?
The great advantage of this smart assistive technology approach is that maintenance and indeed damage is far less than with traditional devices. The biggest maintenance issue is ensuring that the smartphone is charged. And I think today, even those disadvantaged groups and even the homeless who wouldn't have a fixed line telephone, they are familiar with mobile telephones, and the actual power needed by a smartphone to run these apps is comparatively small. I think it's a significant move. I think service providers are the ones who have the opportunity here to ensure that people understand what maintenance actually means for a smartphone. It means keeping it clean. It means ensuring that the socket used for the headphones is clean. In fact, I would suggest that the headphones are the most likely thing to break. So go out and try them. Most of them are free. I think I tried 27 different hearing test apps before I finalized on the half dozen or so that I have shown. You can search for apps, of course. The Play Store and the Apple Store will show lots more. But go out and do it, is my advice to everyone. Find one that works for you and stick to it.
Okay, we've got a question from our colleague Gareth from Victoria. Gareth is a very active member of the European and Australian Living Labs network, so welcome on board, Gareth. Gareth's asking a question about responding to your comments, Kevin, about the item equipment being clunky and not looking nice, looking institutionalized. Yeah. Is there any evidence or research that you can point Gareth to that shows increased adoption or compliance based on aesthetics of equipment?
I think there's ample evidence to show that lack of aesthetic appeal turns people off, and certainly is one of the reasons for poor utility. And I think this is true not only of the smaller devices that I describe as clunky, but also true of stair lifts and large items of home modification. The challenge is making it better by design and making it more colourful. One of the telecare items that I'm very familiar with is the Carephone range, and the manufacturers have found that the acceptance rate of black Carephones over white ones, the old white or cream institutional ones, saw a threefold increase in usage. Furthermore, the pendants that are used as alarm pendants, when they are given colourful boots to personalise them, again, uptake is increased by 200 to 300%. So I think the number of examples that have been studied formally is quite low, but I think that workshops where end users look at such products at an early stage, it's pretty convincing in demonstrating the significance of aesthetic appeal.
Thanks, Kevin. We've got a number of questions. I'm going to have to sort of plough through these questions in the interests of time. Thanks, Annie. Annie's a researcher at a regional university in Australia, and she comments, thanks, Kevin, excellent presentation. What do we need to do at a strategic level to encourage more older people and younger people with a disability who are apprehensive about using technology to engage with it more fully?
A good question, and I think it's not a question restricted to Australia or to Queensland for that matter. I think we are seeing a natural progression of people getting used to smartphones. I think the market itself is forcing out the middle line of phones, so you're left with a minimal function, sometimes 2 or 3 button phones for people who are actually frightened of anything more, and everything else is a smartphone. And it's when people see the functionality of the smartphone that they really get engaged and say, yeah, actually I'd like to use that, but their fear is of being left on their own when it doesn't work. I think the significance there is for the service provider, their role when they're supporting people who are older and who have a range of deficits, is to demonstrate to them that they are there also to support them with their technology. Now that's quite a change in emphasis for them, and I think there's a workforce development issue there. But the domiciliary care staff of an agency that I worked with last week, they are given everything on a smartphone these days. Their schedule, they notify their arrival, so they are trained how to use it. In fact, they are very familiar. They use the camera to record incidents. They use the speech recording facility to get the views of the people they're providing a service for. So they are very much the advocates of the phone. So I think that's going to be the way ahead for the future.
Okay, Kevin, probably 2 final questions, and I'll take the other ones offline with you. Technical question from Mohan. Is there an open source for developers where you can integrate the APIs as modules in specific applications, particularly in relationship to speech to text?
There isn't yet. I think one of the problems remains that some of the bigger providers, maybe the providers of the original smart microphones and hearing aid systems, if I had to name a company, maybe it would be Siemens. They are protective of their market, and they want to produce, if you like, the gold standard and ensure that competitors that of lower quality don't really get a say in this. I think this is an area where collaboration is needed. Open APIs, I think that's definitely something which should be tried, and I think we should be pushing those open approaches as the only ones for moving forward, because they can integrate so many other things as well.
And I guess there's many groups in Australia that community resourcing and the collaborative members are involved in lobbying for that specific issue. So thanks for those comments. Kevin, a question from Terence. Terence is a small provider, specialist provider. He sees great opportunities to include smart assistive technology across the board for issues, particularly now that individualised and tailored plans are more in the Australian landscape. But his question specifically asking about your exposure in the European UK landscape. Have you got some funding models where in relationship to smart assistive technology this might have been incorporated into individual budgets? I guess that's a fairly complex question to answer, Kevin. Any initial comments from you?
I think the personal budgets approach will be interesting because they haven't really developed in the way that the government intended. Certainly the personal assistance, that side of things worked. The more general approach for people with perhaps a little bit lower needs, they haven't really adopted the change as required. The big opportunity is still going to be in aged care, where more and more people will fall outside existing funding rules and therefore will be attracted to lower cost options on the prevention scale. And many of these will be using this smart assistive technology to do more and more. and indeed the technology itself will demonstrate increasing needs and will form part of future assessments that will enable the personal budget to be increased. That's the model, that's the funding model, but it's not yet sophisticated enough to try and replicate anywhere, and I don't think they have sufficient data to demonstrate if it's worked well. My own belief is that the technology maturity is unknown to government, and therefore they have been looking at individual apps and smartphone applications in the acute healthcare space rather than the long-term care and disability sector, where I feel that it probably will play a bigger role.
Thanks, Kevin. That's all that we've got time for today in terms of questions. Thanks everyone who's posted your question. We'll take the questions we haven't been able to get to in the next couple of days. We'll get back to people and get Kevin to answer those specific questions. Just a couple of more webinars we've got coming up. On the 15th of December, we've got the webinar on the use of electronic assistive technology for people with disability living in shared supported accommodation. So that's a great webinar to consider attending. We've got a number of upcoming activities planned so far for the first half of 2017. February, we've got a series of rural and remote Smart Assistive Technology roadshows through various geographical areas. We'll be bringing you some more information about those, and we'd love to hear from any service providers or individuals in those areas. On the 14th of March, a number of organisations and entities are coming together to hold a community care business transformation through innovation conference, and this is going to be in line with the following day on the 15th of March, a whole day workshop with the Australian Living Labs Innovation Network, looking at consumer engagement in co-design and co-creation of technologies. More information of those two events will be out early next week. And also in the latter part of March, we'll be holding a series of events through New South Wales with a number of international guest speakers. We're also holding a number of events at the end of March in conjunction with the World Science Festival, and I encourage you to be involved in some of those events, some really great events concentrating on specific applications like robotics for independent living. We're going to do a road tour of Far North Queensland in April, so if you're a provider, I know that there's a couple of providers on board today who are geographically based there or have an interest, and particularly have an interest in looking at what's happening at the rollout of NDIS in the areas up in Far North Queensland, so keep your eye out for those activities. And then in June, I know that many on the webinar today are considering joining us again for one of our study tours internationally, and this time we'll be going through Asia, looking at some living labs, and finalising in Canada in conjunction with the International Congress on Smart Homes and Health Telematics. Today I'd like to formally acknowledge the Community Care Smart Assistive Technology Collaborative Project Team led by Elizabeth Dodd. Thank you, Elizabeth and Imogen, particularly for your organisation today. I'd also like to highlight the voluntary contribution that the expert reference group members play in the development and guidance of the platform. Formally like to acknowledge the seed funding that the Queensland Government has given for the development and their foresight in allowing the service provision aspects of the platform to be extended nationally and internationally. And particularly, Kevin, I'd like to thank you today, our presenter, Dr Kevin Doughty, It's probably well past midnight today in in Wales. So thank you for attending today and to providing us with your research and investigations into this particular area. Thanks everyone who's participated in today's session. Any questions on today's session can be emailed at the address on your screen now. Thanks everyone.